Do we want to get started, or do we want to wait a
Yes.
couple minutes? Yeah.
2:04. I think let's get started. The main part of the presentation will take the bulk, so let's get into it.
Okay, sounds good. So do we have Barb McCaffrey on the line as well, or?
We do.
Excellent.
So I'll just give, for everyone on the call, this week we are using an interim webinar platform solution, and it is interim because we're upgrading to a new platform. So thank you all for bearing with us. Leanne has pulled together a go-to webinar for us. Some things that you'll notice is that you have come on muted, and you've heard us talking about pulling you off mute. When we get to questions, for sure, you can use a put up your hand function you'll see on your right toolbar, and we can take you off of mute so that you can speak your question. And if you have something to say in the middle, we can use that as well. So Barb and Chris and team on the CII presentation, just so you know that there's no free speaking, so that is something a little bit different. Yeah, so that's just so you know, it's an interim solution for this month webinar only. And you can also use the questions function at the bottom. So you can type that in and it'll go to staff, and then we will monitor that and ask your questions if it's typed in. So thank you. Next slide,
Okay,
please.
well,
Angela, I'll turn it to you to introduce this.
okay, great. So our webinar today is called "There's No Place Like Patient's Medical Home for the Holidays," and we're going to hear about some of the initiatives relating to information systems in the province, such as CPAR and CII coming up. They're going to be, coming out to clinics and to so we can all collaborate together with better information. So I don't think there's anything else I want to say other than to introduce Barb McCaffrey. And are you presenting with other people as well?
Yes, Angela, this afternoon I'm here near Alberta Health with our colleagues. So it's Chris Diamond and I from the AMA, and our colleagues that work on the project with us from the Alberta Health side are Sheena George, who is the implementation lead for community information integration, and her colleague and our team member, Chris Chandra. So we're ready to go. Okay,
well, take it away, and we will take some questions at the end.
And Leanne, can you pass the controls over to Chris, and he will run our presentation from our side?
And it's John here. We just wanted to give a little bit of context, Barbara, just for the IFs in the province, just to say that each of the things that you've asked to talk about, or the topics that have come up for the IF network, have some common threads in the patient medical home. And so, for instance, most of you, if not all of you, have worked with clinics and practices and your PCNs looking at ASAP, for instance, and panel identification and monitoring over time. So many of these big chunks of work that have been a priority for you over the last several years all continue. All of that work continues into things that are continuing in the future. Access is another good example. And so we just wanted to let you know that all of the pieces that you worked on, are working on, and things that you brought forward as topics for the next year will have common threads, and we'll keep revisiting what those common threads are within the patient medical home development. So yes, Barbara and team, please take it away. Thank you.
Thanks, John. Hi, everybody. My name is Chris Diamond. As Barb said, I'm a member of the AMA team working on the CII CPAR project. And we're going to talk to you a little bit about this technology today. Hopefully you guys have heard of it and maybe know a little bit about it, but hopefully by the end of today, you'll have a lot more information. So I just want to start out, next slide, please, Chris. I just want to start by mentioning that the CII CPAR project is a joint project between Alberta Health Services, and the AMA. All three organizations are in full support of this project and are working on it together. Next slide. And before we get into the nitty-gritty about CII CPAR, I just want to ground this in the reason that we're doing it. So CII CPAR is some very cool technology, but the reason that we want to adopt it is because it will help to enhance continuity between patients and providers in Alberta. And when we think of continuity, we think of it as how one patient experiences care over time as coherent and linked, as the result of good information flow, good interpersonal skills, and good coordination of care. It happens when separate and discrete elements of care are connected, and when those elements of care that endure over time are maintained and supported. And of course, it matters over all three of its dimensions: informational continuity, management continuity, and relational continuity. And I'll say just a little bit about those three things. Next slide, please, Chris. So relational continuity is what we generally think of when we think about continuity. It's that when the door opens to the exam room, is it my doctor that walks through, or is it another doctor? Is it a member of my doctor's team that walks through, or is it somebody else? Does the person who walks through that door know me and know my story, or not? That's relational continuity. But there are other aspects of continuity as well. Informational continuity is the right information available to the right people at the right time? That's, of course, very important. And finally, management continuity or care coordination. Are transitions of care well dealt with, and are all of the members of the healthcare team well informed? Do they have access to the right information? Are they talking to each other and coordinating that care? That's management continuity. Thanks, Chris. So probably most of you have seen this slide already. The evidence for the benefits of continuity is quite clear. And we quite often like to refer to work done by Dr. Richard Lewanchuk here in Alberta. His research on continuity has been strong and has an Alberta focus. And he often says that the best thing that you can do for your health is to have a family doctor and see that family doctor and have continuity with that family doctor. And I want to just talk a little bit about that because I was at the Accelerating Primary Care Conference this last week and had a conversation with a doc who said to me, you know, Albertans aren't going to like it when we tell them that they have to see only one doctor. And I, of course, had to say, whoa, that's not the message that we're trying to send. So I want to talk about that a little bit and make sure that that message doesn't get delivered inadvertently. We're absolutely not saying that Albertans need to see one and only one physician. What we are saying is that the benefits of continuity are so important that we need to encourage them to have a relationship with a primary provider and try to see that primary provider as much as possible and always make them their first point of contact. We know that not always will patients be able to get in to see that primary provider, and they may have other reasons for wanting to see a different provider, and that's fine. Albertans have that choice. Nothing about what we're doing here takes that choice away from Albertans. We just want to encourage them to have that quarterback, have a relationship with that quarterback so they get that continuity of care. Next slide. So I want to talk a little bit about where we're at now in terms of a hypothetical patient journey. When patients go to see their primary provider, they're paneled and their information is recorded in the EMR, and that's great. Sorry, Chris? Okay, yeah. And that's great if that happens. But we know that there's a number of gaps in the system, and we're hoping to close some of those gaps. So a first gap can happen when they're referred to a specialist. The specialist only gets a certain amount of information. They don't really have access to the information that's in that primary provider's EMR. If that specialist refers the patient to another specialist, the chances of the primary provider getting the report from the second specialist are pretty small, and the primary provider doesn't have access to it in any other way. Should the patient end up in the hospital or ER, the docs there don't really have any information about the patient, and the doc doesn't, the primary care doc doesn't get notification of that. And finally, if the patient is discharged, the chances of them falling through the cracks are fairly high because there's no information provided back to a primary care doctor that event has happened. Next slide. And I'm going to pass over to Barb to talk about what a future journey with that patient might look like with this technology.
Yeah, with CII and CPAR in place across Alberta, this is an opportunity for a future patient journey that is different from the picture that Chris painted. So in our first step, the patient is paneled to a provider. In other words, they've chosen their quarterback in a medical home. And the quarterback in the medical home then chooses to record that in the EMR so that the clinic and team have knowledge of which patients are there for longitudinal comprehensive care. Next, that patient might, so that's recorded in the EMR, and then the clinic is participating in CII CPAR. So this is an important first step because with that participation, information goes up to Alberta Netcare, and it is stored in a database in Alberta that reflects which patient belongs to which provider. At the same time, that clinic can participate in CII and share their encounter information with Alberta Netcare too, which is another crucial step we'll see later on. When that primary care provider refers that patient to a specialist, and that specialist is participating in CII, they now have a means to share their consult reports to Alberta Netcare with the touch of a button with each consult report that is completed, and that records that consult report in Netcare. Then if by chance that specialist referred the patient to another specialist, that too will get loaded into Netcare, and there's that information that is becoming more complete in the patient's record. Now, should that patient then go to emergency, not only would they know from emergency where that patient's medical home is and who their primary provider is, ER now has information that is newly available to them through the Community Encounter Digest that's come up from CII clinics. And it provides an at-a-glance information of encounters that patient has had in the system. And also, the emergency department has access to those specialist consult reports that were loaded into Netcare. And then the next thing that happens is upon discharge, an e-notification will go back to the primary provider's EMR to tell them that the patient was in hospital or went to emergency, or in other cases, it will also tell them if the patient was in day surgery. In that case, the family physician and or the team has an opportunity to follow up with the patient. So this is a much different scenario than what Chris was showing. So this is all new, and we're wondering what do Canadians and Albertans think about this? So in 2016, Canada Health Infoway surveyed Canadians and what our Canadians thought about access to their health information. So most Canadians think that digital health will ensure that that clinicians have access to those information for their patients. And overwhelmingly, patients think it is important that it should be shared across the system. 96% of Canadians thought so. And also the majority of Canadians, 74%, thought that it would have a positive impact on the health system. Now remember, these are Canadians being surveyed and not just Albertans, because the last statistic also shows that for Canadians, they're not confident right now that their health care providers are currently sharing information for a holistic view of health. So again, this is in Canada where Alberta Netcare doesn't exist. But if we go along next and we look at a survey of Albertans, and they were surveyed in collaboration with the Alberta Medical Association and a patient board called albertapatients.ca. In 2017, they were surveyed about what was coming with the community information integration. Now, the first statistic is rather interesting, and that stat says that most patients actually think that there's already more sharing that already exists. So they think that because their doctor has a computer in the office and they see computers in the hospital, they're already assuming that more sharing is happening. So that's an interesting stat. But when they were described a detailed description of the community information integration system of information going from clinic EMRs to Alberta Netcare, 93% say they approve. Now, that's not saying they didn't have any concerns. They had concerns about access to the information, security from hackers, and that there was patient consent for this going on. So one other important distinction when the survey was done is they asked Albertans what they thought about data collection going into a database for healthcare improvement. And initially, they weren't so sure about that. And that is also something that happens with the CII system, is data is collected for research and improvement purposes. And patients weren't so sure about that, only 40% approved. But once they were described what the full CII information was doing and that it was about improving care delivery in Alberta, the majority of patients were approving of the community information integration project. So let's look at how this is going to work in Alberta. So we know that panel is one of the key and foundational elements of the patient's medical home. CPAR is the next logical step for all these practices across Alberta that have established or are establishing their panel processes. CPAR is a next logical step because it will be the next stage in panel management where we can ensure that practices are managing their own patients. We are onboarding clinics right now in the testing phase. Sheena's going to talk a little bit more about that. And we expect broad rollout next year. So what's going to happen is as CII and CPAR are designed now, we expect that CPAR is going to be the reliable registry of who belongs to who in Alberta for patient care. What's really neat is the data is going to upload automatically from the clinic EMRs on a monthly basis. There's going to be no onerous upload process. And so it will reflect what is happening in the practices because we recognize that patients are born, they pass away, they join a practice, they leave a practice. And so as the panel is fluid in the practice, it will be uploaded regularly to the provincial registry. What's also important here is that CPAR is going to be very foundational for informational continuity. And we're going to talk a little bit more about that as we move forward. I'm going to pass it over to my colleague, Chris Chandra here. He's going to describe you what the infrastructure looks like.
Thanks, Barb. So the following diagram represents how the information moves from the EMR and ultimately how it ends up in Alberta NetCare and the Alberta Healthcare Data Repository. So on the left-hand side, we can see that within the EMRs, within the community physician offices, there's three types of information that ends up flowing. One of them is the clinic encounters, the clinical encounter data. Then there's the patient panels and the specialist consult reports. All three of those information streams end up in the CII Data Hub, and that is the integration engine that compiles the information and checks with the provincial client registry to make sure that where the correct information is being appended to the correct patient. We know from experience that approximately 2 to 3% of patients do not pass this check, so that information gets stopped at the hub. Alberta NetCare then receives the clinical encounter data, which is in the form of a CED, Clinical Encounter Digest, and it also receives the specialist consult reports in the form of a PDF. The patient panel information gets sent to the Central Patient Attachment Registry, CPAR, at Alberta Blue Cross, and all of that information also ends up at the Healthcare Data Repository at Alberta Health.
So what does it look like today? This slide, which we're looking at, is our timeline. So currently today, we are live with Community Information Integration, that's CII. We are live with one vendor. It is MicroQuest on the HealthQuest EMR. We were launched in June of 2017. From that time period going forward, we've been uploading specialist consult reports, as well as the Community Encounter Digest from our family practice and PCN clinics. Today, we're actively working with what we're calling our beta clinics. So this is our testing phase. So from this moment till about March, mid-March, we're looking to engage with 10 clinics, currently working with 4 PCNs, and those PCNs could be using MicroQuest, So that's the Health Quest system, MedAccess or Wolf, which is from TELUS, and PS Suite. So who are the PCNs? We're actively working with Camrose, Leduc, Beaumont, Devon, Chinook, and South Calgary. We're anticipating to go out with general rollout to your clinics and your providers and health teams in the spring of 2019. At that point in time, we will be working again across all 3 vendors. QHR will also come later in 2019. This coordination is going to happen with the primary care network. So let's see what it looks like from a snapshot. So currently we have 15 clinics that are live on CII. So the timeline is looking from June to November of 2018. We're across the province. We're in St. Albert, Edmonton, Sherwood Park, Camrose, Lethbridge, Calgary, Banff, and Edson. We're pulling up data from allied health professionals, dietitians, nurses, nurse practitioners, family physicians, specialists that are contributing include cardiologists, neurologists, geriatricians. We have an OBGYN. We also have psychiatrists and psychologists. So knowing that we have 15 clinics that are live, it's important to understand how that information is helping to bridge what we see as the information gap from community information with the information in our health systems. So looking at Netcare, and we've been live in Netcare since December of 2017. Over 50,000 patient encounters have now been submitted to Alberta Netcare portal. That encounter data is from over 16,000 unique patients, and that's coming again in the form of those Community Encounter Digest reports, which also means we have over 5,000 consult reports that are uploaded into Netcare.
Okay, so these reports that end up in Netcare, as we had mentioned, one of them is the Specialist Consult Report, and the other is the Community Encounter Digest, or CED report. The consult report will pretty much come out exactly the way it is in the electronic medical record, and it's stored in a PDF format in Netcare. The CED is also a PDF format. However, it is reformatted. The encounter information is put into the report into a 1 or 2 page document. And the information that's presented there are the reasons for the visits, the health concerns, possible allergies, clinical assessments, referral requests, and observations. Not all the information that's coming over from the electronic medical record will be in this report. This is a snapshot of the fields that are coming across from the electronic medical record into both, well, that's going over to the CII hub. The ones that are in white are the ones that are just being uploaded to the healthcare repository, and the ones that are in green will end up in Netcare in the CED report. So as you can see, the provider information, the patient information, some of the encounter fields, the observation fields, and the vaccines and referrals will be in Netcare on the CED report. These are screenshots of a MicroQuest Health Quest system, and it's intended just as an example to show you how the information is going to be mapped for flowing into Alberta Netcare for the CED. So regardless of which vendor is being used, whether it's MicroQuest or Wolf or MedAccess, each system will be mapped in a way to pull these fields into the CED. So the demographic information, the ones that are displayed in yellow on in this sample, will always get sent. The ones that are in red will get sent to the healthcare repository, but will not be in Netcare. And the ones that are in green for this MicroQuest example are configurable by MicroQuest. And here are samples of the 2 reports that we can see in Netcare. So the one on the left is the Community Encounter Digest. So all the information that was in the EMR, I'll back up again here. So in this format, in the electronic medical record, will be consolidated into one report, the CED, that looks like the one on the left there. And the one on the right is the specialist report, and that will look the same as it does in the EMR, with a few added headers and footers.
So it's important to understand when we shared with you, there's over 80, potentially over 80 data elements that could come across from your community EMRs. It all depends on what your clinic physicians are using in the EMR system. If they're not populating this data field, that information won't come across. We've also shared that information comes through and is displayed in Alberta Netcare in the form of the 2 clinical reports that Chris has reviewed with you. But it's also important to know that information goes into the healthcare repository. So when you're talking with your physicians and they're asking you questions, often what's come up is how come there's health service codes or encounter billing codes? Because they'll see that that gets pulled up from the system as well. That's only used for secondary analysis, and we don't use that for any other purpose except to support the planning and research. There isn't actually any dollar value or cost included with that. We also know that currently Alberta Netcare portal, they house, pardon me, dispense medications, our DI results, and our lab results. They are considered our source of truth. Because of that, this project is not looking to bring across redundant information. They understand it already exists in Netcare, so that's where we go for that. We are pulling across the lab orders and the DI orders, again, to our healthcare repository, but that's, again, for exploratory research, just to really understand what's sitting within your EMRs and your community clinics, so we can have a better understanding of what information is stored there and what can be accessed in the future. So everything we've done to date has been very focused on that transactional relationship when a patient comes and sees a physician. We've been calling it as episodic data. It's a snapshot. So we've heard from clinics and physicians, your physicians and your clinic teams, that they want more than that. They're looking to have something that the community clinics themselves can use and give them some greater value. So we've heard that, the AMA and Alberta Health has heard that, and what they're bringing forward are 2 really exciting things. The first is e-notifications. That will be coming to your clinics in late spring of 2019. We'll talk a little bit more explicitly what e-notifications are, but really up to this point, everything has been one way of data flow. So you can think of when you sit with your clinics and your physicians, we're pulling information up, we're uploading information. Now with our new e-notification, you're going to have bi-directional data flow. So now this is information from those provincial systems like Netcare, healthcare repositories coming back. Specifically, we're looking at what's in the AHS systems. We're looking at notifying the patient's medical home when a patient is admitted or discharged from a hospital or day surgery, or they visit an ER department. So that's what we mean by the bi-directional data flow. The second important value add is the patient summary report. So the CED, that's a rolling snapshot of the encounter, that site visit with the patient. The patient summary, this is going to give you more detailed information. It's more like where you're going to see something like a problem list. The importance of the patient summary is this will play a key role in improving the continuity of care, and again, in supporting the patient's medical home. So we've talked a lot about what we look like today. This diagram here is where we're going. So I'd like you to focus on the red arrows and the information in red, as that is the new pieces. So reading from left to right, we've talked to you about the 3 kinds of information rather, the clinical encounters and the panels and the report. Note, like as I mentioned before, patient summary is new. That's going to be coming in. If you look further down, you're going to see that we have notifications. That's going to be the hospital admit, discharge, ER visits, day surgery. The difference here is you can see that the arrows are showing the information is coming from the systems back into the EMRs, back into your community clinics. In Alberta Netcare, you'll see that we're now going to go from 2 clinical reports to 3. We're still going to be sharing that panel information with our CPAR registry, and the information is flowing into the healthcare repository. So the big message today is where we're moving is towards a bi-directional data flow. We're moving to make sure that your physicians and your clinic teams are notified when patients are admitted or discharged, and that there's more comprehensive summary reports that will be available in Netcare.
So I think you guys hopefully can already see that there's a bunch of benefits, potential benefits from having this technology, but we've imagined quite a few. On the patient side, this meets their expectations that this information is actually already being shared. Should lead to more coordinated and consistent care and smoother transitions. They should have to tell their story less. There should be less duplication of care when people understand who's really on their panels and who is not. We know from the evidence that this should decrease time in hospitals and increase patient safety, and maybe most importantly, increase everybody's satisfaction. On the physician side, benefits to relational continuity include having a clearer picture of the panel and the ability to deliver better and more focused care. Informational continuity across the system will be a huge benefit. In terms of transitions of care, it'll be easier to plan and deliver and to coordinate with other providers in the circle of care. We've already heard that from one PCN that is doing CII that this is saving them time already, and we expect that to be common amongst the clinics that adopt this. And then for the system, we know again from the evidence that this should lead to lower healthcare costs and less utilization, and the ability to do to use information for secondary use like health system planning and research is something that just doesn't exist in Alberta right now and is a very exciting possibility. So I just want to talk a little bit about what this will actually look like on the ground, because that's sort of everybody's question is, okay, this is all really good, but how much work is it going to be and what's it going to look like? So we see this sort of happening from a clinic's perspective in 6 steps. Step number 1 being something like what you're experiencing right now, an engagement and interest presentation and discussion, where the clinic finds out more about what it is and what's in it for them. Then the biggest and probably the longest part of the process would be registration and participation. If you've ever been through getting on to NetCare from zero, that is initially choosing an access administrator and filling out all the forms and doing all of that, it's not the simplest process, but it's necessary because information sharing is part of it, and whenever you're sharing information, I's have to be dotted and T's have to be crossed. So the registration and participation part is probably the most effort on the part of the clinic. Once that's done, onboarding and go live, where there's a little bit of back and forth between the vendor and the clinic and Alberta Health to make sure that the information is flowing and the right information is flowing. And then on go live, making sure that everything is actually going to NetCare and CPAR where it belongs and making sure it's correct. Panel management and process improvement. So we're going to talk a little bit about this in a second, but with CPAR, you get a couple of extra reports that you had never had before, conflict report and demographic mismatch report. And there's a little bit of work to do to incorporate those things into your normal workflow. But they'll be very handy for that panel management piece that Barb mentioned earlier. And finally, a little bit of post-implementation evaluation to make sure that we're always doing our PDSAs to make sure that our processes are getting smoother and smoother, and it's getting easier and easier for people to participate. And of course, we're working hard to develop tools for PCNs and clinics to make sure that this goes as smoothly as possible, make sure that things are coordinated and that we're always engaging with the clinic. And we're validating them right now in our testing phase. We're not just testing the technologies, but we're testing all of the supports around that to make sure that what we're developing actually works. Next slide.
So what does it look like to participate? So we do have different types of requirements, and we look at it from a readiness, commitment, and compliance perspective. So to assess readiness of your clinics and your physicians, we need clinics to be live on Alberta NetCare. They need to have their clinic TIA up to date, and as we mentioned, their vendor needs to be conformed. So right now we're working with MicroQuest. TELUS has been conformed, and we're closely working with them in the December-January timeline. And they also need to be panel ready. From a commitment perspective, we are looking to have a site liaison. We're calling them a CII CPAR site liaison. And the role of this individual, and it can be anyone at the clinic, whoever the clinic appoints for that, is to manage the readiness requirement, to assist us with the data quality testing. So what that means is we're actively working on our training materials, our awareness materials. We would look for feedback from that individual and have them support in any of the assessment meetings we have there. We're looking to have clinics and their liaison sign a participation agreement Because we are in beta, and as Chris had mentioned, we are actively doing PDSA, so things are changing. We're continuously monitoring and adapting what we have, and so general rollout, it may look very different. So that agreement is about keeping things in confidence while in this phase. So compliance. Know that Alberta Health has completed a CII PIA, Privacy Impact Assessment. So from a compliance perspective, what we're asking from your physicians and your clinic teams is that they sign a PIA endorsement letter. We're also asking that the custodians have a Health Information Act, an HIA Information Management Agreement, IMA, that they have it is up to date with their EMR vendor, and that agreement is actually signed on behalf of the custodian and liaison. Now, as I've mentioned, to participate in CII CPAR, we do need the clinic, so your clinics do need to be live on Netcare. If you know that your clinic is not live on Netcare, understand that we're here to help, and we have some Netcare readiness material in place. What we've put on the screen here is the website, so where you would go to get that information. It's the same team that would also work with you actively as they're onboarding, and if you have any privacy issues or concerns as well. So PIAs, Privacy Impact Assessments. We know we've been getting lots of questions, and your teams may be getting that as well, or your physicians may be asking, or know also from a PIA perspective, Alberta Health is actively working towards developing seminars and self-assessment guides so that we can bring this information to your clinics and offer that support. So just some basic information. A privacy impact assessment, it's important to know when we're looking for an up-to-date one, there could be situations where a minor update is required, a minor PIA update. So what does that actually mean? Let's say you have new physicians joining the clinic, a new privacy officer, or a new primary custodian. A minor update is really about adding or developing a letter and sending a letter to the OIPC, that's the Office of Information Privacy Commissioner. Once you've sent that letter, we can actually move forward with your clinics and onboard them for CII CPAR. If it's more of a bigger update, it's a major one. An example is a new EMR or adding a patient portal or any kinds of new users. But again, if you have any questions, we're always here to answer them later. So another word about privacy, note this project is covered under Alberta Netcare's Health Information Act, which means that we're not telling patients that they need to, physicians don't need to talk directly with their patients. We're providing all kinds of support material like a health collection poster and custodian scripts. There's opportunities in your EMR to enable flags so that if patients come up and say they don't want information to be shared, there's an opportunity to train your physicians so that they don't share that information.
So I don't think we need to talk too much about panel readiness to you guys. I think you probably understand about panel and moving clinics towards their panel readiness. Just want to know that there should be 4 key behaviors happening in a clinic that's panel ready. They should be asking at every interaction who the patient identifies as their primary provider and recording it in the EMR and date stamping it. And that date stamp is particularly important. I'm going to harp on it a little bit because it's important when you get your conflict reports. Maintain and review the panel list and use the panel list to plan care delivery. And if those 4 things are happening, clinic is most likely ready for CII CPAR. But just in case, we've prepared a panel readiness checklist, and you can find this on our website. It has all of a bunch of steps that you can go through with your clinics to just make sure that they're doing all of the things that should be good. And of course, one of those steps is confirming with the patient and recording in the EMR the date that confirmation happened. The next slide. So just a quick word about uploading to the registry. When we talked about this about a year ago, it looked like we were going to have to upload CSV files manually from EMRs into the CPAR registry. I'm happy to say that that's no longer the case with CII. The process is automated or mostly automated. For HealthQuest clinics, they will go into their reporting function in the EMR and use a specific CPAR report to generate panels that looks like what you're seeing on your screen. And to upload the report, all they have to do is click Submit on Panel or Submit All Panels. I don't actually have any pictures of Wolf or MedAccess because there is nothing to do for those systems. TELUS has automated it completely. Once you're signed up, panel uploads will happen automatically. And you heard me mention a little bit earlier about conflict reports and demographic mismatch reports. I just wanted to show you those two reports quickly here. This first one is the conflict report, and hopefully you can see it reasonably well. But you can see there's a fair amount of information there, and it shows the patient, the last name and first name and date of birth and gender, the date of last confirmation with the provider and the date of last visit, and also shows the conflicting provider, the date of last confirmation with the conflicting provider and the date of last visit for the conflicting provider. And you can see that that last confirmation date is actually quite important. If that information is incorrect, then the report is not as valuable as if that information is up to date. The next slide. And the demographic mismatch report will have two sections to it. The first section will list patients on the panel that are listed as deceased in Alberta Health's patient client registry, or provincial client registry, excuse me. And hopefully that will help some of those embarrassing conversations. And it's a piece of information, the mismatch report in general is a piece of information that'll be really handy right off the bat. It might take a little while for conflict reports to be useful as we wait for people to get into the registry, but the mismatch report should be useful immediately. And the other half of the mismatch report just shows places where the information in the EMR is different than what is found in the provincial client registry, and that will give you the ability to either update your EMR or let your patients know that their information is incorrect at Alberta Health.
So as we move along in this project, as Sheena mentioned, we are in the testing phase right now, and supports are in development. Some are already made for you, the improvement facilitators and PCNs, from the team at Alberta Health and us at the AMA, and include areas in leadership engagement, communications. That's really going to ramp up in the next, this month in December and moving forward through spring. As Sheena mentioned, there's going to be privacy guides and videos and tools available from the privacy team at Alberta Health. And privacy is a clinic responsibility, and you as improvement facilitators would guide those needing to update their PIAs to those resources. There will be support to register, onboard, go live, and evaluation is really key for our beta phase, and we'll be doing evaluation as well. There will be that feedback opportunity once we go into general rollout. In the meantime, we are also developing quite a few training resources to train improvement facilitators and the PCNs that are ready to go in the springtime. We're testing those resources right now as we move ahead with the beta clinics. There will be EMR guides to use the CPAR application, and videos to support that, and something we're calling the Team Toolkit, and this will be available for both the primary care network teams and the clinics. As we're moving forward as well, there already are testimonials from the clinics that have been involved in the CII project to date, and they range from being somewhat being effortless in participation, but also there are some really good case studies where information sharing has resulted in efficiency between the participating clinic and the local ER, and that one was demonstrated in Bow Valley. Again, as you need to move forward, we do have information on the top website, and it's on the CII CPAR tab, and there's quite a bit there, and if you scroll down on that website, you'll see some documents that are ready for download right now. And as well, there is, if you look up the Alberta Netcare website, which we already showed, there's information there. So as we move into questions, we'll pause here and see what questions might exist from any of you on the line or that you send to the moderators.
Hi, it's Angile. I was just wondering if you were able to see the questions that I've put on behalf of Edmonton Southside PCN. It's kind of unclear what the chat window is doing. So
we're not seeing them. We're just trying to see if we can get them up here.
If I stop sharing my screen.
No, you don't want to do that.
Actually, yeah, I can verbalize them. It's Leanne. So on behalf of the Edmonton Southside, is it possible to pull consult reports from Netcare in the clinic, into the clinic EMR, or will they still be sent to the clinics in the old ways as well?
Hi, Leanne. So, great question. So CII CPAR, it's not replacing the step of having to still send the original consult report to the primary physician. That still does need to happen. So currently in the project right now, it's only an upload into Alberta Netcare portal. It's not pulling it back into the EMR.
Great, thanks. And what is happening with Accuro systems?
So currently Accuro is in contract negotiations with Alberta Health. So we're actively working with them to bring their clinics on board for CII and CPAR for both applications and technology. So we're looking to work with some of their clinics, identify those in the spring of 2019.
Great.
It might help to know too that Accuro was doing similar work in Saskatchewan and didn't want to get started in Alberta until they were finished the work in Saskatchewan. The work in Saskatchewan is done, and so that's why they're a little bit behind the others. But they're, from what we understand, they're fully committed, and they're just going to be a little bit behind.
Thanks, Chris. And is there a map of what is being uploaded from SOAP notes?
Yeah, good question. So no, there won't. There will be an assessment field pulled, and those maps will be available for anybody currently on HealthQuest EMR. As a matter of fact, MicroQuest is allowing their customers to customize a bit. That won't be available for TELUS EMRs. It will not pull the SOAP note at all, but it only pulls an assessment field. And that way, anything that providers write more in a narrative form in the regular way, that does not go up. That way, they're able to maintain the confidentiality of that information. And until there's readiness for more sharing, that information will stay at the clinic EMR.
Great. And who gets notified with notifications from Netcare? Is it just the physician or the whole care team?
Yeah, that's a good question. It will go into the EMR. So that there will be a little bit of configuration for that, because we anticipate it will look a bit like lab results, but it's definitely something that team play a role in. And as that functionality is finalized, we'll have a better picture of that. But I can tell you right now, we do anticipate that this is teamwork and not just physician work.
Okay. And the Edmonton South side is asking, and they're wondering if the entire group is able to potentially answer this question. What role do you see IFs playing in the registration process?
I can start that. And I'll use our experience from our beta clinics. So the IFs are playing a role in one, that they're supporting the awareness, and they are aware of the process that needs to be done and directing the clinic to those resources. So the IF really can't register the clinic themselves, but they can play a supportive role both in directing to what needs to be done, and the IF will have supportive documentation for that as well, and ensuring that they're out there to answer questions. Anybody else have something to add?
Yeah, I think that's a great response. I can't really think of too much more I would add. I think that's good. Does that help, Edmonton Southside?
They said yes, thank you.
They are welcome.
Another one from Edmonton Southside is there any synergy between full rollout of this with the CPSA mandate to switch to EMRs by 2020?
Yeah, there's definitely synergy. That's sort of all I think we can say about it. All of the benefits of this only work if you have an EMR and you're using that EMR to manage your panels. So there's definitely synergy, and it's definitely another. If you're out there trying to convince a paper clinic to move to an EMR, it's maybe another arrow in your quiver.
Yeah. And I will point out as well that the CPSA is coming out with a follow-up document based on those recommendations. It's not available at this time, but we will be hearing more from the CPSA about use of EMR and technology.
Thanks. And I'm just going to I see that Anne Mackin had her hand raised a little while ago. And I've taken you off mute. I'm not sure if you want to ask a question.
Oh, I do have a question. Thank you. Do clinics have to have a patient portal to participate?
Sorry, clinics have to have a patient portal, Anne?
Yes, do they have to have a patient portal to participate in CPAR or CII?
No, they don't. Oh,
No, yeah, no, they don't. Good question. So the patient or the My Health portal will be a portal available to Albertans from Alberta Health. And that's where patients can go and see some of their own information. So it's going to start with their 60 lab and DI reports, as well as their own dispensed prescription information from PIN. So the portal that we're talking about is not the same type of portal that a clinic may have, because we know some clinics already do, not many, but some clinics already do have their own patient portal if they are a client of an EMR vendor that makes a patient portal available to them. So no, it will not be a requirement.
Thank you.
Great. And I had one come through on the phone. Will physicians get a large download dump when connected, or have to manage a large influx of results?
Oh, that's a good question. So what will physicians get? So I think we need to distinguish between what physicians will get and what team members will get. So we said the two reports that are downloadable. One is the mismatch notification report, and the other one is the panel conflict report. We anticipate that those are really team reports, and the team members will likely share that information with the physician, but it will be the team that works with that information when they're doing panel management or proactively caring for their patients. When e-notifications become enabled, they will get that information in real time as their panel patients have interactions with emergency or they're admitted, discharged from hospital, or have day surgery. So that information will only come in as their panel patients have that interaction with Alberta Health Services system.
And I think one last one, and I apologize to the person who texted this in to me. I think it hinged on one of the other questions. It says, and what will be the responsibility of taking action on results not ordered by the GP?
Okay. That is, so results not ordered by the GP. So I know there are issues across Alberta right now where a clinic can receive what is likely an erroneous lab report result or lab result. And really the physician never ordered it, but it's copied and they receive it in their EMR. And there are methods that clinics currently handle that. This is different in that the only information that a physician should receive once they, one, signed up for CPAR and they're participating in the panel uploads, they are only e-notifications for the patients that the physician and team said were paneled to that provider. So there should not be any erroneous information associated with CII CPAR participation.
I think it's important to say that none of this should change in any way what is done with what is currently done with orders done by another physician. And I'm not sure any of us in this room are qualified to speak to it any more than that. But whatever is happening now would continue to happen. None of this changes any of that.
Thanks. And I know a couple more questions have come in, but I see that we're at 2:58. So what we'll do is we'll capture those questions and I'll have Barbara and team answer those questions and we'll post them on our discussion board on our Collaborate site.
And Leanne, if we send you a full PDF package, you can post that on the Collaborate site too?
We sure can.
Yeah, because we have things like if people want to see a really detailed look at what the sample CED report, we know you could not see it on the screen. So that is one of the PDF handouts that we have to go along with this presentation, and we'll send it along to you.
Thanks very much for the time, everyone. I know we took up the whole meeting.
Yeah, thanks everybody.
And on behalf of the provincial IF co-design team, we'd really like to thank Barb, Chris from AMA, and Sheena and Chris from Alberta Health for your presentation today. It's really helpful to all of us, because I think there's a lot of ideas, at least in the room here at Edmonton Southside, and I'm sure elsewhere in the province, lots of ideas of how this is going to enhance our work, and also lots of things that we might want to assist clinics with doing differently in the future. For example, I keep thinking that, there's a lot of process mapping that we could end up doing with regard to, how to integrate the reports into clinic processes, and also around referrals in particular. So once again, thanks very much for your time today, Barb, Chris, Sheena, and Chris. And also thanks to the IFs who participated today, and people for sending in questions and just for listening. And also just wanted to let you know the next call is going to be on January the 9th in 2019. That's actually a Wednesday, so it's a little bit different from our normal first Monday of the month. So just be aware of that. So January 9th, and that's going to be on Teams and Teamwork. I think the IFs who are presenting that are still looking for a few clinic level examples. So if you have any ideas, please send those into the IF network. I think that's everything for today. I think it's just 3 o'clock, so hopefully we haven't gone over yet.
No.
Bye, everybody.
Thanks, everyone.
Thanks so much.